scared. And if we're scared, you should be too.
A healthcare system in shambles is how one Toronto nurse describes the reality at local hospitals. Helen Winter works at a downtown ER and has been a registered nurse for almost 2 decades. She tells me right now emergency departments are on the brink.
The capacity I've seen in Emerge in the last week has been astounding. As in, we can't handle Emerge patients because all of our beds are taken up with patients admitted waiting for beds, and there are no beds. We're just seeing people just wait for hours and hours in pain, in need of medical care.
So from your perspective, when someone comes to the hospital in an emergency situation, what kind of health care are they receiving at this point?
Depends on the day, but certainly they are receiving far, far lower standard than they have every right to expect and that they have already paid for. We cannot accommodate people right now. Emerge is taking the brunt of everything.
The number of patients in Ontario hospitals with COVID-19 is up by 27% from a week ago, but it's unclear how much of a strain the sixth wave will have on overall capacity. With such a high vaccination rate, the province says the healthcare system can handle what's to come while continuing to clear the massive surgical backlog. But Helen tells me the medical monsoon we're now dealing with goes far beyond COVID.
Even if COVID magically disappeared, the crisis remains. We have now people coming in with chronic diseases who have been unable to see their specialists or see their family doctors the way they needed to. And so now those chronic diseases are having exacerbations. We see people are sick. There's so many diagnoses that have been missed because people can't access medical care or they've been scared to come to the hospital when they need to.
Since the pandemic began, nurses have been leaving in droves. Right now, Ontario is down over 20,000 nurses and frontline workers continue walking every day. Recently, the Ford government announced a retention bonus, a learn and stay grant, and has put a rush on hiring internationally trained nurses to help fill that massive gap. But Helen believes it's all too little too late.
We're losing so many experienced nurses and you cannot replace them with new grads. So they're being fast-tracked through without getting the proper experience they need. And there's no senior nurses left to show them the way.
Helen helps run an advocacy page on Instagram called Nurse with a Sign, a platform where frontline workers are encouraged to share their experiences. Many of the posts involve stories of abuse and exhaustion. And as healthcare workers brace for whatever the sixth wave will bring, Helen says total frustration is a general feeling amongst her colleagues.
The billions given by the federal government that were never used. Why? This is people's lives we're talking about.
Shauna Hunt, City News.